Do I need Medicare if I plan to work past 65? Your Medicare enrollment options when you're working past 65 may be different. You may be able to delay, or you may be able to, have to enroll at age 65. So there's two scenarios. Generally, if you delay Medicare past 65, you would not incur a penalty as long as you're employed by a company employing more than 20 employees. They're COBRA compliant. And the employer group health coverage is considered creditable. That is typically indicated in your employee handbook, but you could go to HR or talk to the member service number on the back of your card if you're currently in a group plan and you want to know if your plan is creditable. You do need to enroll at age 65 if your employer has fewer than 20 employees, because then Medicare is primary. Your coverage is not considered creditable. If it's not considered creditable, then you should sign up for Medicare. One of the things that we often do with people who are on the fence about coming to Medicare is we can help you evaluate, even if you do work for an employer over 60, past 65, and they have more than 20 employees, the question then becomes a value question, whether you should go to Medicare or not. Sometimes, if in the example, my wife was a school principal, and we all know teachers have great benefits, and the lion's share of the premium for both family and employee is probably 90 or 100%, then it's a no-brainer in that environment. You're going to be better off staying on that employer-paid, very robust plan. Often, the school systems and government employees have really great benefits, and they're the lion's share is paid by the employer. So there's an example of why you might continue under the employer group. But sometimes, if you're working for an employer that is over 20, but they don't, contribute a significant amount, or sometimes they contribute a lot to an employee, but they don't fund dependents so well. So we can help you evaluate whether, just because you can, whether you doesn't mean you should. You can stay, but sometimes there's a better value. And we welcome those kinds of discussions. The commitment we make here at Dublin Health and Benefit is we're always going to give you all of your options, not just the options that we sell. So other options might be COBRA or Medicaid or your employer group, and we'll help you evaluate and determine whether you're better off. We'll give you the right answer, even if we talk to you in a couple of years when you retire. So we talked about this, what if I'm covered by my spouse's employer? As long as they're paying the lion's share of it and it's creditable coverage, you will not pay a penalty for postponing eligibility into Medicare. If you say your spouse or you work till you're 68 and then you step off the ride, your employer will sign a form called an L564 testifying that you've had creditable coverage, and that opens the door for you to come into Medicare, even though you're 3 years past age 65. Getting Medicare while still working, your Medicare and your employer insurance can work together. Sometimes, if you take any part of Medicare, this is an important point, by the way. If you take any part of Medicare, you will no longer be able to contribute to an HSA. So if your employer or your spouse's employer is, has an HSA type format and you're funding that, you do not want to take either A or B. You'll lose your eligibility to fund that health savings account. Medicare will not cover anyone but you, so consider how any dependents will be covered, and that's what I meant by, we can assist you with children and spouses who are somewhat orphaned from your leaving a group benefit plan, and perhaps they're not eligible for Medicare yet. We can find alternatives.